Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about diagnostic criteria, peripheral blood features and bone marrow findings of primary myelofibrosis. Primary myelofibrosis is a clonal myeloid neoplasm characterized by impaired medullary hematopoiesis and predominant proliferation of granulocytes and atypical megakaryocytes, accompanied by a gradual increase in bone marrow reticulin and collagen fibrosis and extramedullary hematopoiesis. Primary myelofibrosis shows a gradual, stepwise progression from an initial prefibrotic or early stage to overt fibrotic stage. Diagnosis of prefibrotic stage requires meeting all three major criteria plus at least two minor criteria. Major criteria include megakaryocyte proliferation and atypia in the absence of reticulin fibrosis, accompanied by increased marrow cellularity, granulocytic proliferation, and often decreased erythropoiesis. Not meeting WHO criteria for other myeloproliferative neoplasms or myelodysplastic syndromes. And demonstration of Janus kinase 2, calreticulin or myeloproliferative leukemia virus oncogene mutation, or other clonal marker or no evidence of reactive marrow fibrosis. Minor criteria include leukoerythroblastosis, increased serum lactate dehydrogenase, anemia, and palpable splenomegaly. Diagnosis of fibrotic stage requires all three major criteria, and at least one minor criterion must be confirmed in two consecutive determinations. Major criteria include megakaryocytic proliferation and atypia, accompanied by reticulin or collagen fibrosis grades 2 or 3. Not meeting WHO criteria for other myeloproliferative neoplasms or myelodysplastic syndromes. And demonstration of Janus kinase 2, calreticulin or myeloproliferative leukemia virus oncogene mutation, or other clonal marker or no evidence of reactive marrow fibrosis. Minor criteria include anemia, leukocytosis, palpable splenomegaly, increased serum lactate dehydrogenase and leukoerythroblastosis. Primary myelofibrosis presents with a broad range of changes in laboratory test values and peripheral blood film results, but examination of the bone marrow biopsy specimen provides most of the information for diagnosis. Prefibrotic stage of primary myelofibrosis may present initially normal or increased blood counts, mild neutrophilia with a left shift and mild to moderate thrombocytosis. Myeloblasts, nucleated red cells and teardrop-shaped erythrocytes are rarely seen during the prefibrotic stage. The hematological picture at presentation of primary myelofibrosis is very variable, but shows various typical features including the presence of granulocyte precursors, erythroblasts and teardrop-shaped erythrocytes in the peripheral blood film. At the time of diagnosis there is often a moderate anemia, associated with leukocytosis. The platelet count is moderately increased in 30 to 50% of patients. In fibrotic stage, RBC count and hemoglobin value are normal or decreased, and in 2/3 of patients there is reticulocytosis. Abnormalities in erythrocytes noted on peripheral blood films include the presence of anisocytosis, poikilocytosis, polychromasia, nucleated red blood cells, teardrop-shaped erythrocytes and other bizarre shapes, and erythrocytes containing Howell-Jolly bodies, basophilic stippling and Cabot rings. Granulocytes are increased, normal or decreased in number, and may include immature granulocytes, blasts, and cells with nuclear or cytoplasmic anomalies. There is also often a relative and absolute neutrophilia. Eosinophilia, basophilia, or both is observed in a small percentage of patients. Absolute monocytosis may be observed in a small number of cases. Platelets may be normal, increased or decreased in number, with a mixture of normal and abnormal morphologic features. Giant platelets and abnormal granulation may be observed. Circulating micro-megakaryocytes, bare and often pycnotic megakaryocyte nuclei and fragments of megakaryocyte cytoplasm may be present. CBC results and diagrammatic representation of the differential count of an 84-year-old man with primary myelofibrosis showing anemia, increased RDW, and the presence of erythroblasts. Peripheral blood film showing anisopoikilocytosis and teardrop-shaped erythrocytes. Peripheral blood films showing teardrop-shaped erythrocytes. Peripheral blood film showing circulating erythroblast. CBC results and diagrammatic representation of the differential count of a 61-year-old woman with primary myelofibrosis showing mild anemia, increased RDW, reticulocytosis, mild thrombocytosis, and the presence of immature granulocytes and erythroblasts. Peripheral blood film showing anisopoikilocytosis, teardrop cells, and polychromasia. Peripheral blood films showing myelocyte and 2 circulating erythroblasts. CBC results and diagrammatic representation of the differential count of a 59-year-old woman with primary myelofibrosis showing increased RDW, thrombocytosis, monocytosis, and the presence of erythroblasts. Peripheral blood film showing anisopoikilocytosis, teardrop cell, target cells, and microcytes. Peripheral blood films showing Howell-Jolly bodies. Peripheral blood films showing giant platelets. Peripheral blood films showing circulating orthochromatic erythroblasts. CBC results and diagrammatic representation of the differential count of a 76-year-old woman with primary myelofibrosis and positive calreticulin mutation, showing mild anemia, increased RDW, and leukoerythroblastosis, which is the presence of immature granulocytes and nucleated red blood cells. Peripheral blood film showing anisocytosis, teardrop cells, and polychromasia. Peripheral blood films showing leukoerythroblastosis, which refers to the presence of immature granulocytes and erythroblasts. CBC results and diagrammatic representation of the differential count of an 85-year-old man with primary myelofibrosis showing mild anemia, increased RDW, thrombocytopenia, monocytosis, and leukoerythroblastosis. Peripheral blood film showing anisocytosis, teardrop cells, and thrombocytopenia. Peripheral blood films showing immature monocytes, blast cells, and erythroblasts. CBC results and diagrammatic representation of the differential count of an 82-year-old man with primary myelofibrosis and increased serum lactate dehydrogenase level, showing leukocytosis, increased RDW, thrombocytosis, and left shift. Peripheral blood film showing anisocytosis, teardrop cells, thrombocytosis, leukocytosis, and left shift. Peripheral blood films showing left shift and the presence of immature granulocytes. Peripheral blood films showing immature eosinophils. Peripheral blood films showing a circulating bare megakaryocyte nucleus and a giant platelet with pseudopods. A bone marrow biopsy is essential for the diagnosis of primary myelofibrosis. The biopsy should be assessed for overall cellularity, the relative numbers of cells in the various myeloid lineages and their degree of maturation, the amount and grade of fibrosis, and the morphology of the megakaryocytes. Biopsy results exhibit marked fibrosis with islands of hematopoietic activity and pockets of clumped megakaryocytes. Aspiration attempts often result in a dry tap. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.